This presentation will tell you what to expect before your operation, when you're in hospital, after your operation, make you aware of possible complications after surgery, and on your discharge from hospital. To avoid potential risk of hip dislocation after your operation, we currently advise that you follow these precautions. Do not cross your legs or cross imaginary midline. Do not bend your hip beyond 90 degrees. Do not twist at the hip. Avoid kneeling for approximately 3 months after your operation. We strongly advise you to purchase long holidays prior to your surgery. This will enable you to adhere to hip precautions. Preparing for surgery will ensure you do not need to stay in hospital longer than necessary. What you can do to prepare for surgery. Practice transfers and exercises. Prepare your home environment. Remove any trip hazards. Ensure you have space to mobilise and allow space for any walking aids. Stock up on food. Arrange any support you need prior to surgery. Completing these tasks will make you feel more confident on your return home from hospital. Prior to surgery, we advise our patients to maintain good personal hygiene to reduce the risk of any infections. What to bring into hospital? Loose fitting clothes and a comfortable shoe, ideally with a back on. Exercise booklet. Any other home comforts you wish to bring. Any regular medication you currently take must be in its original packaging and labelled with your name on.
If you're not diabetic, you'll have been issued with 6 carbohydrate loading drinks. These drinks are for you to take prior to admission. You need to drink 4 drinks on the night before surgery and 2 drinks on the day of surgery. You take the 2 on the morning of surgery an hour before your admission time. So if you're coming in at 7 o'clock, you will take them both at 6. And if you're due in hospital at 11, then you will take them both at 10. On admission, we admit you in this order. We'll check that nothing's changed, and we'll check that nothing's changed from when you've had your pre-op assessment. Between now and coming into hospital, it's important that you keep yourself as well and healthy as you can. If anything changes, if you get a cough, a cold, a cut, a sore, an open wound at all on your skin, it's important that you let somebody at the hospital know so that we can assess whether you are going to be well enough to come into hospital. If we do have to defer your operation, it doesn't mean that you go to the bottom of the waiting list and have to work your way up again. It just means that we swap it for another patient so we don't lose that theatre slot. One of the surgical team will come and see you and they'll put an arrow on your thigh depending on what hip you're having done, and the anaesthetist will come and speak to you about the anaesthetic. The operation is normally done with a spinal anaesthetic. It's a one-off injection into your lower back and you're going numb from the waist down. Most patients will have sedation so that you're not aware of what's going on in theatre, but the anaesthetist will also speak to you about the general anaesthetic as well. If you want to bring some music in to listen to that during the surgery, you're very welcome to do that as well. We ask that if you're using inhalers that you bring those into hospital with you and you actually take them down to theatre with you. When you are ready to go to theatre, we do walk you down to theatre and you'll go into an anaesthetic room. In the anaesthetic room, they'll place you on a trolley and they'll attach you to a heart monitor, and that will just monitor your heart rate and rhythm during the operation. The anaesthetist will put a needle in the back of your hand and attach you to some fluids. Then if you opt out spinal anaesthetic, they'll sit you up on the trolley and get you to lean over, and that will open up the spaces in your lower back. The anaesthetist then will feel your back and clean your back with some cold solution. At that point, you will feel a little bit of pushing as they get into the space and will inject the anaesthetic. You'll then feel your legs go very heavy, very warm and very numb. The anaesthetist will do various tests on your legs to make sure that you can't feel anything and that both your legs are blocked. If then you choose to have some sedation, that is given to you and off into theatre you go. If you have a general anaesthetic, you put to sleep and off into theatre you go. The operation normally takes around about 60 to 80 minutes and then you're back out in recovery. You normally stay in recovery about 30 to 40 minutes just to make sure that you're generally okay, your blood pressure's okay and you're comfortable, and then you'll come back to the ward. As soon as you get back on the ward, we're going to get you eating and drinking straight away. We're going to get you freshened up, hopefully in preparation of getting up out of bed. And we aim to get you up, standing, even mobilising, walking a few steps on the day of your operation within a couple of hours of coming back from theatre, and we'll start your pain relief as well. So as soon as you get back from theatre, you start to feel that post-operative pain, then we will start your pain relief. Day one after surgery, we're going to do some routine blood tests to make sure that you're not anaemic and that your kidneys are functioning okay. And post-operatively, after surgery, it is important that you drink plenty of fluid so that you don't become dehydrated. And we'll also do a post-op check x-ray as well.
It is important to mobilise on the day of your operation. Doing so reduces stiffness and accelerates your recovery. The therapy team will monitor your return to the ward, and when appropriate, we will come to see you. We will begin with bed exercises where we will check your range of movement and muscle strength. The first time mobilised, you will use a frame. Please complete the exercises on a regular basis. This is essential after your operation to gain the best outcome. Therapy input day 1. Use long-handled aids to help you get dressed. We aid progression of mobility from a walking frame to elbow crutches. We will complete a stairs assessment as appropriate. We will practice your transfers and encourage you to be independent with your washing and dressing. Therapy discharge goals. To be independent with mobility, stairs, transfers, washing and dressing, and meal preparation.
Hip replacements can be painful, but what we suggest is that you take your pain relief on a regular basis. You start to mobilise, do your exercises, sit out of bed, and that pain will get easier. But it can take a good couple of weeks really before you start to feel that your pain's getting better. Constipation can be a problem after surgery, so we start you on laxatives on the night of your operation, and we also send you home with laxatives as well. We encourage you to drink plenty of fluid, and we also want you to mobilise. We will check every day while you're on the ward to make sure that your bowels are functioning okay. If you're struggling, if you're feeling uncomfortable, you've not been to the toilet, then we can intervene with further medication. You are at risk of infection following the surgery, and that's why we want you to come into hospital well and healthy. When you go home, if you've got any problems, any concerns, any worries about the dressing, about the wound, anything to do with your operation, then you will be issued with some contact numbers. Give us a call, tell us what your concerns are, and then we can assess on what we need to do. You're also at risk of what we call a deep vein thrombosis following the surgery. Basically, it's a blood clot in your calf. So we'll start you on medication the day after your operation. We use foot pumps and calf pumps while you're not mobilised and while you're in bed. We're going to get you to do some circulatory exercises, and we'll get you to mobilise very quickly after the operation. So we are doing all we can to reduce that risk of a thrombosis. You will get post-operatives swelling to the leg. It's quite common after the surgery, and it can take anywhere up to 6 weeks for that swelling to subside. What we ask is that if you get swelling, sit your leg elevated, do your circulatory exercises, and that swelling should reduce. But what you'll find with the DVT is you will do all that, but that swelling won't reduce. With the DVT as well, your leg will look very red, it'll look shiny, and you'll get pain in your calf. If you get any of those symptoms, we say you're either in the ward, or if it's easier, you go to your nearest emergency department to get checked out, just to make sure that you've not got a blood clot in your leg. You're also at risk of a chest infection after surgery, and that's why we're encouraging you to get up, get out of bed, mobilise, do some deep breathing exercises. You're also at risk of what we call pulmonary embolism, which is a blood clot in your lung. The hip can become loose and wear out. Obviously it can dislocate, and that's why I'm asking you to follow the hip precautions for the first 3 months. You can get a foot drop after the operation, so one of the nerves that supplies the lower limb can be a little bit stretched during the operation, and that'll mean you won't be able to lift your foot up and down. If that happens, then we would fit you with an ankle and foot support until that nerve recovered, so that you can still carry on with your rehab.